So how can our nervous system be responsible for chronic pain? Chronic pain not meaning bad, but chronic being long-lasting. Pain that stays with us for a long time or comes and goes but never really seems to go away. A lot of research is beginning to point towards the nervous system being responsible for long-term pain. In fact, not just our nervous system, but how we respond to life. And this is sometimes called the biopsychosocial model. Our biology responds to our environment and our life. In the old days, we tended to think that we were hard-coded, our DNA dictated exactly how things were, and that therefore we were somehow separate from our environment and our society. And this simply is not true. If we look at the amount of diseases which are actually biologically DNA hard-coded, it is in the order of about 1 in 10,000. Most diseases and disorders that we get are not inevitable. Many may reside within our DNA, but are activated by some event. We know, sadly, people get issues which come after car accidents, or ladies who develop rheumatoid arthritis or MS following childbirth. And we have to ask ourselves, why does this happen? Well, if we look at the nervous system's response and trauma, then this gives us some understanding. We need to talk a little bit about Epi Genetics. Now, Epi Genetics is that we have a sort of series of potentialities within our nervous system which we can activate or turn on. We can turn on and activate the chromosomes on the DNA helix. And this can then cause the DNA to manifest and express itself, is how we call it. So the expression of the DNA can then come out as a result of an event in our lives. So now this really helps us to understand how diseases, disorders get activated by events in our life. Disease, you see, we think of disease as being something we catch. Well, it isn't. Let's break the word down. It's dis-ease. It's a lack of ease. That's all it is. Now, an organ can become diseased. An organ can change its biology. So we think, oh, well, surely that can't be a life event. This is something going wrong with the organ. Well, yes, it is. But why? Well, our nervous system is responsible for the state of health of our being. Very, very responsible for it. We all know that our immune system activation is, our immune system is suppressed by stress. We get stressed out, we work too hard, we don't sleep enough, then we know our immune system is suppressed and we catch a cold. We all know that. So let's put this common sense observation of life and let's start looking at it in terms of the wider aspects of healthcare. So using the biopsychosocial model and an understanding of trauma in the nervous system and fear, fight, flight responses really revolutionizes how I go about treating chronic pain.